Hi, I'm Joel Schneider, an interventional cardiologist with Wake Heart and Vascular. PCI is a term for percutaneous coronary intervention. Most people are more familiar with angioplasty or balloon angioplasty or coronary stenting. These are techniques that interventional cardiologists use to treat blockages in heart artery. The condition is actually called coronary artery disease. And we know that patients who present with chest pain or angina or even heart attacks often have a very tight blockage in one of the coronary arteries or heart arteries. The initial evaluation is to talk to the patient and do a physical examination. And this often will lead to a stress test or other studies to try to come to grasp with whether that patient truly has heart disease. At that point, when the suspicion is high, patients will go on to what's called a coronary angiogram. And what we would do is put catheters into the heart, usually working through a small artery in the arm called the radial artery or an artery in the leg called the femoral artery. And under X-ray, be able to visualize how well the heart is functioning and also look at all three of the heart arteries. And from that diagnostic study, a determination will be made how best to treat the patient. And that treatment could be anything from medications to stent implantation or even bypass surgery. If a patient has a very severe blockage that we believe is causing significant symptoms or putting the patient at risk for a heart attack, it's at that point that we would open that artery up, or what we call revascularization, and implant the stent. The major advantage of having the new PCI or coronary stent procedure at Wayne Memorial Hospital is that we can act on that diagnostic angiogram, so that if the decision is made at the time of the diagnostic catheterization to perform a stent procedure, then everything is in place to move forward and treat the patient at that time, so they don't have to have a second procedure. Our goals are to see people exercise, to have discretion with their diets, to keep their weight in check, such that they don't develop heart disease. And so, as exciting as it is to have this program locally, really the concept is not to use it. We want to see our patients improve, have a very positive outcome from what we're doing here at Wayne Memorial Hospital, but ultimately to achieve good health and prevention of primary events or future events.